McNeil, and I am one of the managers of the implementation science team here at RNAO, and I will be moderating the webinar today. I'd also like to introduce you to Andrea Stubbs. Andrea is a project lead for the Best Practice Champions program, and she's online today to help anyone who might have any technical questions related to the webinar. And so these monthly webinars, they are for you. They're for you, the RNAO Best Practice Champions, to help you with your guideline implementation. And our speakers include champions and members of BPSO teams who are actively involved in best practice guideline implementation. So we'll be mentioning the BPSO program today, but not everyone might be aware of what it is. So quickly, BPSO stands for Best Practice Spotlight Organization, and BPSOs are healthcare and academic organizations selected by RNAO through a request for proposals process to implement and evaluate many of RNAO's best practice guidelines. So this is a dynamic partnership, and it's focused on making a positive impact on patient care through evidence-based practices. And RNAO provides support to organizations through a formal agreement to implement and evaluate multiple guidelines over a 3-year period and beyond. And today we'll have a presentation by Kathy Miller from the region of Peel that's on creating and sustaining best practice guidelines to improve quality and safe care and long-term care. But just before I hand things over to Kathy, I wanted to mention a couple of things. So I'd like to ask for your participation today to make this webinar interactive and engaging for everyone. Kathy might ask you questions during her presentation, and you type in your comments and your questions throughout the presentation today in the chat box. And what I'd ask you to do is select the all panelists and attendees in the chat box so that everyone can see what you have to say, and that just makes it really interesting for all of us. We're also going to have a 10-minute question and answer session at the end of Kathy's presentation. So if you do have questions or comments along the way, I can bring these forward to Kathy at the end. And if you're wanting to look at these slides again or listen to the presentation or share it with your colleagues, we will archive the presentation today and post it on RNAO website. So now it's my great pleasure to introduce you to Kathy Miller. And Kathy is a registered nurse with a master's degree in business administration, an advanced graduate diploma in management, a certification in Canadian risk management, and she is a Canadian healthcare executive. So Kathy has worked for the past 5.5 years as a long-term care homes inspector with a compliance and inspections branch of the Ministry of Health and Long-Term Care. And prior to this, she worked in the hospital sector, excuse me, as a she retired from her position as the Vice President of Quality, Safety, and Performance at St. Joseph's Health Centre here in Toronto. In addition, Kathy was an associate professor at the University of Toronto in the Master of Science Quality Improvement and Patient Safety program through the Institute of Policy and Health Management. Kathy assisted in the development and taught the legal, regulatory, and risk course in the program and is recently retired from this position. Kathy has an extensive background in leadership, education, policies and procedures, quality improvement, patient-resident safety, enterprise risk management, and quality assurance. So that's a really impressive background, Kathy, and we're delighted to have you today. So I'll hand things over to you, and you should have the ball to advance your slides.
Great. Thank you so much, Susan. So I'm just seeing if it's advancing, and it's not. You're controlling. It's not advancing the slides.
Okay. Perhaps, Andrea, you can support that and advance them for her.
Technical difficulties.
Usually there's a very light arrow. There goes it.
Oh, there we go. Thank you so much, Andrea and Susan. Welcome everyone to the Best Practice Champion Information Sharing webinar. So what I'd like to do today is to share with you our journey and experience that we have had at the region of Peel with the Best Practice Champion implementation. I'm getting a bit of a delay on these slides, so bear with me. As Susan mentioned, the title of my presentation was Creating and Sustaining Best Practice Guidelines to Improve the Quality and Safety of Care in long-term care homes within the region of Peel. Our agenda that I would like to talk to you about today is implementing, spreading, sustaining the BPGs across the long-term care homes, but more from a regional approach. How we utilize the BPGs to improve quality and safe care to our residents, and monitoring activities and outcomes to sustain and continuously improve. How to overcome some of the challenges that we face, and then the next adventure of our journey as a best practice spotlight organization. The region of Peel, just to give you a bit of an overview, we have 5 long-term care homes. 2 of them are located in Brampton, 2 are in Mississauga, and 1 in Bolton. And we have over 1,000 dedicated staff, including over 380 RNs, RPNs, and PSWs. We're also an accredited organization by CARF, which is the Commission on Accreditation and Rehabilitation Facilities, for over 16 years. The picture that you see actually reflects when the region of Peel received its first BPSO designation in 2017, and has pictures of our Director of Long-Term Care as well as our administrators, directors of care, and members of our team. And you may recognize Simon, who's one of our long-term care consultants. Not advancing, there we go. So as I mentioned, the region of Peel achieved their first designation as a best practice spotlight organization in April of 2017. And with the implementation of the RNAO best practice guidelines, it aligns very well with the region's long-term care strategic plan to improve the use of evidence-informed best practices with the goal of ultimately improving the health outcomes for our residents. In collaboration with the RNAO, the implementation of best practice guidelines has helped us to foster a trust and confidence with our residents and their families, both in their care as well as the services we provide. It also enables us to demonstrate our accountability to other bodies such as our Regional Council in Peel, the Ministry of Health and Long-Term Care, Health Quality Ontario, as well as to our accrediting body. To talk about quality and safety of resident care, we need to review what some of the core principles for quality and safety are. The intention to improve. We want to ensure that we focus on our residents and families and staff, focusing on our processes and systems that we have in place, proper use of our measurement and statistics, involvement of everyone, continuously testing our changes that we're trying to implement, improving upstream, collaboration, and valuing the interdependency of the work that we do, as well as the key role of our leaders. As an example, such as improving upstream, this would include upstream factors that have an impact downstream at the resident care level. For example, external factors that can affect the downstream activities and interventions are things such as the Long-Term Care Homes Act and regulations that govern us in Ontario, the current changes, which there is a lot of that going on right now in the Ontario healthcare system. Then there's the internal upstream factors that also may include the strategic plan. We also look to our strategic plan as far as prioritizing our evidence-informed best practices to drive quality and safety and establish that culture for improvement in our organization, as well as the infrastructure implemented to support the implementation and sustainability of the BPGs, ensuring that we have the right resources with the right expertise in place to assist with data collection and analysis, and do we have policies in place that provide guidance to our staff when providing care to residents to ensure that it's evidence-informed best practices. In addition, do we have the education in place to provide the knowledge and skills for our staff to improve quality and safety of care to our residents? So I just wanted to share with you have a look at what we do at the Region of Peel around our continuous quality improvement program. This is a snapshot of our CQI program at the Region of Peel. You will see that we're aligned with the core principles for managing quality and safety. Our CQI elements incorporate the core principles as outlined, as you can see in the slide, but also the quality framework was developed and implemented. We have engagement of our residents and families and interdisciplinary team members, and being in long-term care, we have residents councils and family councils that we're able to access and engage them. We use evidence and best practices to inform our decision-making. We have a performance management system in place. We've established a culture of continuous improvement throughout our long-term care homes. And we have identified the roles, responsibilities, and resources to support quality and safety, such as the implementation of our BPGs. We have the infrastructure in place. Examples are the policies and procedures and protocols to support care and staff. And we have standardized processes in place, which includes improvement tools and methodologies, such as the PDSA and 5 Whys, and the training of staff using the long-term care toolkit from the RNAO and the QI methodologies that they are also trained on. Next slide. I think a lot of you may have used rapid cycle improvement and have been in those organizations that are implementing the PPGs. And certainly when we look at rapid cycle improvement at the Region of Peel, we do PDSA cycles, which are Plan, Do, Study, Act, with the hope that we want to ensure that what we are trying to accomplish with this, how we will know that the change is actually an improvement, and what changes can we make that will result in that improvement. Rapid cycle improvement is used throughout our long-term care homes, not only with the BPGs, but also for other work that we do related to quality improvement. And again, that just demonstrates the interdependency of the work that we're doing and integrating it into quality and safety. Bit of a delay. The next slide. Okay, thank you. From where I'm looking, I don't know what you're seeing, but my slides are a bit off from what I'm seeing. This is a picture, a timeline of our journey at the Region of Peel. And as you can see, we've set the stage and continue to improve to ensure evidence-informed best practices using the RNAO best BPGs. We started our BPG implementation in 2014 in one long-term care home with the implementation of the assessment and management of pain, and we spread that across all of our 5 homes. We then implemented falls prevention and falls injury in the older adult in all 5 homes. And then in 2017, as I previously mentioned, we received our first BPSO designation. The following year, in 2018, we then implemented the person and family-centered care and preventing and addressing abuse in all 5 homes. At this point, we had implemented and spread 4 PPGs and implemented another 2 PPGs, which we call cluster PPGs, at the end of 2018, related to the interprofessional collaborative practice among nursing and developing and sustaining nursing leaders. We are currently spreading them across the remainder of our 4 long-term care homes. And our plan going forward towards the end of this year is to implement 2 new BPGs related to the assessment, prevention, and management of pressure ulcers and injuries. So all of the work that I've just shared with you, you can see that across the 5 long-term care homes, it is supported by our BPSO infrastructure that we've developed. This is a visual of that structure that's in place and supports the teams throughout the 5 long-term care homes. As you can see, there's leadership support and resources identified at the top with our DLT, our divisional leadership team, our extended divisional leadership team, and then our Director of Care Prayer Group and other resources such as myself, clinical coordinator, and our quality management specialist. As you can imagine, there's a large body of work that is supported by the structure, and the communication goes up and down the structure. An example I can give you is related to the implementation of the assessment, prevention, and management of pressure injuries, which is the one that we're working towards for the end of this year to implement. This has been actually integrated into the work plans for the directors of care as well as our supervisors of care, with reporting to and from each team and to and from the leadership teams. This also has supporting resources such as myself, and I also act as the BPSO liaison for the Region of Peel, our quality management specialist, our clinical coordinator who does all of our NQAR data, and also there's other resources that we may utilize, such as our purchasing specialist. I wanted to share an example of how we have been using the NQAR data at the Region of Peel. So the BPG is the assessment and management of pain. And this example is one that we are currently sustaining. Our aim was to reduce the percentage of residents with worsening pain by 10%. Regionally, we were at 5.3%, and by Q3 of 2018, we wanted to achieve the 10% reduction, which we did, and we were measuring less than the 4.8%. It was quite a lofty target, but it also demonstrates the integration of the best practice guidelines into our CQI program at the Region of Peel to improve the quality and safety of care of residents. This you may be familiar with. This is a graph from the NQAR data. So this demonstrates how we did and did we achieve what we wanted to accomplish. And as you can see in the graph, there was definitely a variation. But when we look at all 5 homes collectively in the last quarter of 2018, the median across all sites was 4.26%. So we did better than our target, and we celebrate that on behalf of our patients, our residents, and their families. However, one of our long-term care homes called the Davis Center in Bolton, they had seen a spike of residents with new pain in the last quarter of 2018. So they did a look back and compared the same period between 2017 and 2018. They found that although they had a spike of residents with new pain, the trend for worsened pain had demonstrated a downward trend going from 2.95 to 1.4% in the same period. The team at the Davis Center concluded that pain for residents was being better controlled and staff were assessing pain consistently. They also identified, because they had drilled down, that the spike was related to several new admissions during the specific time period. And I think this really just demonstrates the work that goes on within the homes when they receive the data and the conversations that need to happen and drilling down to see what the root causes are for those variations. On the next slide, you'll notice this is actually what we call our BPG scorecard. It's hot off the press. It's actually still a work in progress, as you can probably see. We are using the traffic light approach, so the red, yellow, green, and this will be a valuable tool as we go forward with our teams and our leaders in long-term care to see at a glance how they are doing. It can be used to evoke discussions among the team members and also to identify improvement opportunities. So our keys to success, as you can see outlined in the slide, are related to using our existing structures so that the BPG implementation, the spread, and sustainability is integrated into our day-to-day work and doesn't become a project. Engaging our residents and family and staff, and communication is very key. Utilizing the residents and family council and involving them as much as you can. Keeping our champions involved and providing opportunities to influence their peers. For example, providing them with the tools and using them to train their peers. We have tremendous support from our leaders in the organization at the Region of Peel and our partners such as the RNAO, Health Quality Ontario, and other resources that we access externally, and also among our long-term care colleagues. They have been a great resource. Lastly, we needed a formal framework for evaluating, spreading, and sustaining our BPGs, and it's continuously improving and evolving. So no work goes without its challenges. And as we continue to grow and evolve as a BPSO in implementing, sustaining our best practice guidelines, these are some of the challenges that we face. Not all, of course, because it's been a journey. Maintaining engaged BPSO champions and interdisciplinary team members, and ensuring that our indicators are measuring what it is what we want to achieve for our residents and their families with the implementation of the best practice guidelines. Then we can sustain this by integrating it into our existing structures and performance management system. And then alignment of our PPG indicators. There's a lot of data collection that we're doing internally, and as well as that we're reporting externally to so many sources. So it's important to align wherever we can. So as we go forward, lighting the way forward with a little bit of sun coming through the trees, hopefully we'll see the sun soon enough. As we go forward, we always need to keep in mind at the Region of Peel, we want to ensure that we have the right support and the right resources to support our indicator development, our implementation and monitoring of our performance management system, ensuring that we identify the indicators prior to the BPG implementation so that we can identify improvements, standardizing where possible our reporting internally and externally to our stakeholders, keeping our BPSO champions engaged and finding out how they want to be involved and how to involve them, and give them the support and nurture their leadership skills. It's only a win-win situation. And to be able to communicate and educate. As I mentioned previously, peer influence is very effective. And when we have our PSWs training other PSWs, it has the greatest impact of all, rather than someone like me doing that training. It's coming from the people that actually do the job and know it really well. So the next steps for us at the Region of Peel, we are in the process of spreading our clustered best practice guidelines related to the interprofessional collaboration practice among nurses and developing and sustaining nursing leadership. Implementing the 2 new clustered best practice guidelines related to the assessment and prevention of pressure ulcers and the assessment and management of pressure injuries for the interprofessional team. Applying for the clinical fellowship, advanced clinical fellowship at the RNAO, which we already did. So I'm glad I can tick that one off. I don't know if we're successful yet, but we should hear shortly. And also to apply to become a host site for BPSO training for champions. And also to continue to review and analyze and share our indicator outcomes, communicate to our teams and our residents and families. Last but not least, we are planning to celebrate our recent BPSO redesignation that occurred last month with our champions, which we're very excited about. I think I ran out of space on the slide, all of the things I wanted to put on around celebration. We'd like to share this with our champions and interdisciplinary team members and our residents and families in the homes. We are delivering to the 5 long-term care homes. We have BPSO banners that we have purchased, and they stand about 7 feet tall. So with the Region of Peel and the RNAO BPSO logo on it as well. And they will be displayed very proudly in the long-term care homes. And of course, you can't go to celebrate with also having some cake. So we will be providing that to each of our long-term care homes and making plans to do that in the next couple of weeks. The commitment and passion and dedication to quality and safe care for our residents is truly the reason for our success at the Regional Appeal. And we're very thankful for that, because ultimately our goal of improving quality and safe care for residents cannot be done without them. So this is the end of my presentation, and thank you very much.
Thank you so much, Kathy. This is really an excellent presentation, and you have so much to celebrate. I'm envisioning your 7 feet tall posters, but also your staff standing very proudly beside them, because you've accomplished so much in a relatively short amount of time. 5 homes, 1,000 staff, and I think the count was maybe 9 BPGs.
Yeah, we're getting there.
Yeah, so that's incredible. So big congratulations, and thank you for sharing some of the reasons for your success. So I'll just remind people that this is time for your questions. So if you have questions, to type in the chat box, and there are a few of them that I'll share here, as well as I have a couple of my own. And I also just wanted to comment on how you've used your data collection. You showed your Inquire data and the decrease in the worsened pain. What I wanted to note is that it seems like you've done a really great job at looking at the data with your staff, that you're having that conversation, you're interpreting the data together, looking at those root causes, and then celebrating your successes. So I just wanted to point out that really stands out as a very strong feature. So thank you for sharing that. So just a question about, are there any specific tactics or approaches that you've used to engage your residents and your families? Can you say anything more about that, Kathy?
Well, I think, as I mentioned as well, we, in long-term care, we have residence council and we have family councils. We're able to engage them there. In addition to, we have posters up for our BPSO and our best practice guidelines that we're implementing. So we're able to have those conversations with our families and residents. Mm-hmm. We also do we have a continuous improvement program. So we do these, what we call CIP huddles. Right. And when we do those huddles, they're usually in an area where you have residents and families, and we've had residents and families in 1 or 2 of our homes that have actually joined in to hear what's being discussed and talked about. So we use whatever opportunities that we can. I know that some of my colleagues from the Regional Appeal actually may be online. I don't know if they can add anything to that.
Yeah, and that's really interesting that your huddles aren't private, that you're making them public. I'm curious if other homes or other sites have used the same strategy, because that sounds like a really interesting way to engage people in the process.
Yeah, I think it does work very well in integration. I think you're always constantly trying to improve.
Yeah.
And certainly, although there's been a huge amount of work that amazed me, because I've only worked at the Regional Appeal for the last almost 4 months. Yeah. And to see the amount of work that has occurred throughout all 5 homes, I think it demonstrates the commitment and the engagement at all levels.
Yeah, so that leads to one of the questions here, is about how you establish the culture of continuous quality improvement. So you mentioned the importance of peer influence, like PSW training, or PSWs who are training other PSWs. Is there anything else that you think you've done really well in terms of establishing a culture of continuous quality improvement? Maybe you've kind of said it all already, but just wanted to bring that question forward.
Well, definitely, as you can see throughout the presentation, that in itself, the work that's being done, is what assists in embedding the culture. And culture doesn't change overnight. It takes quite some time for culture to change. And so through our leadership. I think it starts at the top. And with our leadership being very integral and involved, and the collaboration that we have up and down, when you see that BPSO structure that we have as well,
Right.
I think that helps to embed it, as well as not just with leadership, also being visible in the homes and demonstrating the culture of improvement and what that actually means in our day-to-day work. I think that also participating in the teams helps as well. I don't know if anybody
Sorry,
else.
what do you mean participating in the teams, Kathy?
When we're implementing the BPGs,
Okay.
we have our leaders that are involved with participating and actually going through the journey of
I
implementing
see.
BPG.
Yeah. Great. Can
I think Joy, who's one of our directors of care at Peel Manor, she also she raised her hand there.
Okay, I see that there's a couple of, there's lots of questions coming in now. Are there any resources you are willing to share or send to participants?
Yeah, if you'd like to share my email with anyone, I would be happy to share. I think that's really important because we also have all limited resources, and wherever we can share to help each other out. I know that I have the region of Halton and Halton region and region of Waterloo have shared with me with the region of Peel. So yes, anybody that would like anything that we can share would be happy to do that. All we would ask, like anybody else, is you just give us credit for the work that we've done.
That's wonderful. Thank you for that. Sheila says, thank you so much, Kathy, for the presentation. Can you elaborate on how you selected the 5 homes? Were they already working on quality improvement before you got started?
The 5 homes?
Mm-hmm.
The 5 homes are our long-term care facilities within the region of Peel.
Right. So your region does consist of the 5 homes.
It does.
Were they already working on QI before you started?
Well, certainly long before I started at the region of Peel, because when I used to be a long-term care homes nursing inspector, I used to go in and out of some of these homes. So I know what they were doing in their homes in relation to the implementation of the falls prevention PPGs and their pain PPGs. So I actually saw that when I was inspector. So there was quality improvement work already happening in the homes long before I ever started.
Great. Yeah, and you could build on that with the BPSO
yes,
program.
Exactly.
Excellent. There's a question here. With the constant cutting of staff and resources available as a result of healthcare, I think that's healthcare funding. How were you able to compensate at the front end the implementation of staff training?
Well, I think, again, I think everybody has those challenges. But one of the things that obviously we would do is we would go to our leadership team if we feel that we need to have training, maybe a couple of hours or even a half a day. I think we would make a proposal and have done to our leadership team, outlining the scope of that education that is required. We're also very fortunate too at the Region of Peel, we have an educational specialist that's part of my team. And we also have our program support nurses within the 5 long-term care homes that also are educators. So this group of people would make that proposal to leadership, outlining what it is we would like to achieve, and also developing the indicators to measure our successes. And again, that would follow through a similar structure to what we have shown in our BPSO. We utilize other, like it's not unusual in long-term care to do education at shift report, to apply to the RNAO and have an event that we hosted in February where we do our presentations and bring our staff and they learn from that.
Is that the open house, Kathy?
Yeah, the staff loved it, and we got suggestions from our staff based on the surveys. So there's lunch and learns that can happen. There's many opportunities and asking the staff what it is that they would like and when they would like to do that. So it's a balance, I think, overall. And there's lots of great ideas out there within long-term care as to how others also have approached it.
Great. Kathy, I missed a part of the question here is a question around how can you do this work in a very small rural environment? Do you have any insight into that?
Well, I actually live in a rural setting, and I'm used to also inspecting them when I was an inspector, but I can tell you that Bolton is a small town, which is north of Toronto, the GTA, and it is a 64-bed long-term care home, and that's the home that I actually used as an example of how we have used the NQuire data and how that team drilled down further. So I do believe that it doesn't matter whether it's a 240 or some of our homes are 177 beds, or whether it's a 64-bed home. In the 64-bed homes, you're sometimes challenged with resources, but we're very fortunate too with the regional appeal that we have resources like myself and the educational specialists and others to assist all of our homes.
Great, thank you. That's a very encouraging response. This may be the last question. So about the 5 whys approach, can you say anything more about that and who is involved or tips for success?
Well, usually we would involve the frontline staff because they're the ones that are closest to the process, and it's 5 whys is a tool that is used to identify root cause analysis.
Yeah.
So you keep drilling down on why, and that identifies what your root causes are, and then you can actually use other tools to identify them, what suggestions or ideas people would have to improve.
Right, and you get the suggestions and ideas from the staff who are working day to day.
Yeah, there's lots of, the RNAO has tools, and the consultants, especially in long-term care, are a great resource for us. There's also lots of other quality improvement websites like the Institute for Healthcare Improvement and Health Quality Ontario that actually provide you free tools, and the Canadian Patient Safety Institute. So there's lots of opportunities to access free toolkits to assist organizations.
Great. Thank you so much, Kathy. So I think that brings us to the end of the questions that have been posted in the chat box, and you've certainly answered my questions beautifully as well. So I just want to thank you so much, Kathy, for sharing your expertise, your knowledge, experience, and also being willing to pass on any advice that you have or tools to others who are interested in having that sort of open sharing attitude. I think that does so much for the community who is interested in quality improvement.
Thank you, Susan. And yeah, we would like to thank the RNAO as well for all their support, and as well as to the people that are online.
Great. Yes, and I would like to echo that, and thank you for everyone for participating in this webinar today and for your comments and questions in the chat box. So just to reiterate, you will be receiving a link to an online survey, and that way you can evaluate today's presentation and also make some suggestions for future topics. So once you complete the evaluation, you'll get your certificate of attendance that might be of interest to you. So once again, thank you everyone, and especially Kathy, for joining us today. So I'll bring us to a close and wish everyone a great afternoon. And I agree that I hope the sun will be shining the way like you had said, Kathy. So thank you so much, everyone.
Thank you.